Hello, everybody. Good morning. Welcome to this Facebook Live. Today, I am really excited for my guest to share with you his thoughts and his experiences. This is Dr. Matthew Stanford. He's the CEO. I have to read it because it's big. He's the CEO of the Hope and Healing Center and Institute in Houston, Texas, an adjunct professor in the Menninger Department of Psychiatry and Behavioral Sciences at Baylor College of Medicine. And his research on the interplay between psychology and issues of faith has been featured in such national publications as the New York Times, that's not shabby, USA Today, and Christianity Today. Dr. Stanford is the author of two books, Grace for the Afflicted, which I highly recommend, A Clinical and Biblical Perspective on Mental Illness, and The Biology of Sin, Grace, Hope, and Healing for Those Who Feel Trapped. So, Dr. Stanford, I'm so glad that you are with us today. You also were one of the speakers at our very first conference on mental health in the church in 2014. And you and I have been on a task force together and just have had the opportunity through the last, 5 years to speak at different events together and to realize that we share a passion for the faith community to understand and learn about mental illness. So welcome. Thanks for being here.
Thanks for having me.
Yeah, I didn't give you, I kind of talked a whole lot there, but anyway, so glad that you're here. So I want to just start off by having you tell people about the Hope and Healing Center in Houston. Just tell us, what it is, who it's connected. It's connected to a church, and loved for you to give us an overview of that.
Yeah, the Hope and Healing Center and Institute sits on the campus of St. Martin's Episcopal Church, which is the largest Episcopal church in North America. We are a separate 501c3, so we're separate from the church. We grew out of the church, and they provide a building for us, but we raise all of our own money. We are a comprehensive mental health resource for the city of Houston. We offer education awareness programs to the community to break stigma. We offer services for individuals who have serious mental illness. We have individual services as well as 40 support groups a week. We offer a variety of 12-step recovery groups. We also do research. We have a number of PhDs here, mostly working on how people access care through faith communities. And then finally, we do our faith community training, which is our big initiative. Our goal is to alter access and the way people get to care and to reduce hospitalization. So we go into faith communities. We train people, the clergy, the staff, any congregants they want there on how to recognize, how to refer, how to relate to people with mental health problems, and how to set up restorative programs. We set up support groups in those churches, and we train peer mental health coaches to work in those churches so that when people go there looking for assistance, they're able to get professional care, they'll be able to get some care level of care for free, but also have a healing community to support them as they recover.
I just want you to know that every time I hear you describe it, every time I look at the website, I got to visit once and speak at an event. It's like my dream place. It's like Disneyland to me because it just offers such a complete package. It's comprehensive. It's wraparound. At Saddleback, I feel like we've done and are doing a pretty good job at showing how the local church can be engaged in caring for people with mental illness and their families. But the Hope and Healing Center. And by the way, would you give us that website so people can look that up?
Yeah, you can either go to the hopeandhealingcenter.org or you could go to our website that supports all of the faith communities that have been trained at mentalhealthgateway.org.
So as I was saying, I think what is so appealing to me is that it feels like you guys have cracked the nut. You've cracked the code in some ways of how a church, how faith community, pardon me, can offer something even beyond. Prayer is valuable, and praying for people and their needs is valuable. Listening to people, all of that is valuable. But you all have gone, like a million steps beyond that in caring for people in such a comprehensive way. How old is this Hope and Helping? Is it Hope and Healing Center?
We are 7 years old, and I've been here for 3.5 years now. And we are truly comprehensive. I often say we are the only mental health center, free mental health center in the country that see poor and rich alike. So it doesn't matter what your income is or what you make. All of our services are free. In fact, you come here, you can go to support groups, you can get individual care, you can get psychiatric care for free. We have telepsychiatry. Your medication is paid for. So we try to break down all the barriers. But those types of services are the types of things that we're training these faith communities to be able to provide. Certainly the supportive services like support groups and peer counseling, peer coaching, which allows people to access care at some level for free. And one of the things we're missing in the mental health care system is we don't have any lower level providers. We just have high level providers. So if you can't get into a high level provider, you're kind of messed up. Yeah. You have to wait and decompensate, and that's why our hospitalization rates are so high. What we need is in traditional medical system, we need lower level providers that can provide some level of care so that we can keep people from kind of continuing to escalate through that continuum.
And since most of the people watching this probably are not professionals, and the mental health system is so confusing in the terminology, could you just define what you mean by lower level care?
Yeah, I mean, you think about it in the context of when you get ill. So if you start to feel bad, you would go to the pharmacy and you'd get some over the counter. So in some sense, a pharmacist is a lower level provider for a headache or a sore throat. And then if you continues on, you might go to an urgent care. And at that urgent care, you might see a nurse practitioner or a physician's assistant, or even perhaps you're at school and you see the school nurse or an EMT. And so you continue to kind of escalate until you finally end up in your physician's office, and then he says or she says, well, you have to go to a specialist. And then from the specialist, and then ultimately maybe you get hospitalized. And then if you're hospitalized, then from there you go to a rehab center and things. And so in mental health, which there really is no system. I mean, it's laughable that we even call it a system. It's a set of disjointed resources, and you have to find everything on your own. You go straight from your family to the licensed professional. There is no lower level of care. And that's why the cost is so astronomical. And then you go straight from your professional to hospitalization. And then from hospitalization back to your family. So it's this really bizarre triangle of family, professional, hospital, family, professional, hospital. Excuse me. And nothing else like that exists.
I'm coughing too.
Oh, there it's catching. It caught through the internet. But there's nothing else like that. I mean, there's no other medical condition that's set up like that.
And so how is the Hope and Healing Center, how were you able to interrupt that? I mean, for those who are saying, I want that at my church, or, why can't there be something like that in my community? How did it, just give us a brief, how did it come about and how is it sustained?
Yeah, the St. Martin's Episcopal Church, and really for the viewers, if you just saw St. Martin's Episcopal Church, it's where Barbara Bush's funeral was, if you were watching that on television. So, that was kind of weird to watch because I knew everybody there. So this is where President Bush and his wife go to church. And so, they took a survey a little over 7 years ago, and they wanted to know, they surveyed the parish and they wanted to know, how do you want to impact the community? And so what the congregants said, and I'm not Episcopal, and I don't even go to that church. I go to a different church. So which again, I think is part of this whole thing. They weren't saying, we're all going to work there or do whatever. They said, we want to impact people broken by life circumstances, is what they said. So a committee was put together and they thought about putting a center together, particularly initially with 12-step programs. And they just kind of had that on their campus. And then after a couple of years, they built a building specifically for the Hope and Healing Center. That's where you spoke when you were here. And so we've been in this building now for about 4 years, a little over 4 years. And, we raise all of our own money. We're not on the church's budget and never have been. We're a separate 501c3, but they do provide the building for us, which allows us to not have to worry about paying rent and things like that. Now, we do pay back some operating expenses for the building, but, that cuts our budget significantly because we don't have to worry about this beautiful building that we're in. And from there, we just raise money. Our budget this year is about $3 million, and it's increasing every moment because we're expanding. But, we're a faith-based organization. We offer faith-based services. We also offer services that aren't necessarily faith-based if that's what someone's looking for. I mean, I feel everything we do is faith-based because we do it as service to Christ. So we're also intimate, we're overtly faith-based, but we're intimately involved with hospital systems here in town, developing new psychiatric interventions. We have collaborations with a number of very large hospital organizations, both faith-based and non-faith-based. We do academic research. We're real comprehensive. And I think what a place like this says is that a faith community can step out, or a group of faith communities, and impact their community. And they can do that at all levels. We don't have to just say, well, I'll pray for you, which we do plenty of that here.
Right. And it's good. And we need prayer.
Absolutely. But, if somebody has a
prayer is not important, or, obviously prayer is the foundation of our connection spiritually with God. So nobody's saying that prayer is not important. We're also saying prayer, and there's some things in prayer that can, and I love, like I said, it's total Disneyland to me, my dream world. So like if a congregation who might not be able to, maybe they're much smaller than the church and this Hope and Healing Center, what could they do at a smaller scale that would begin to make an impact in their community?
Right. I mean, there's a whole lot you can do. I mean, we have churches with 75 people that we're working at that are having huge impacts. I mean, first and foremost, you can, as a clerical staff, as a ministry staff, you can educate yourself about mental health problems. There's, if nothing else, there's plenty of books out there. We have a great website called the Mental Health Gateway, as I mentioned before, mentalhealthgateway.org. If you go there, it's just about to come online with an all new, but there's videos and all kind of information. I know Saddleback has all types of information, but, educate yourself first. Then, where you begin to then educate your congregation with the same things. I think the easiest thing, in my opinion, that a church can do is bring support groups online. There are great support group curricula out there for people in your congregation to do. Fresh Hope and Grace Alliance, and we have stuff also. There's a lot of different ones. But if you don't have the manpower to do that, all you have to do is contact organizations like NAMI or DBSA, or there's any number of, or even AA, any number of organizations. Celebrate Recovery has material, obviously, from Saddleback. Any number of organizations actually will send a facilitator to your congregation, and you just have to leave the lights on one night a week, and they'll lead a support group there. So, support groups are tremendously effective, particularly for family members as a caring support system. So that's a great way to start. I mean, beyond that, I really recommend that churches set up a pastoral care team just to have laymen that can just be present and walk along. I also recommend that churches talk about their benevolence fund, that their willingness to pay for at least some initial therapy or some initial medication. You would be surprised. I mean, you wouldn't, but your listeners might be surprised. I see people every day that have they have a prescription from a psychiatrist for medication. Can't afford the medication.
Yeah.
So what good is that? And so, making sure that people are able to get the care that so those are all very simple things. I mean, even a sermon about a mental health, talking about depression or, the God's engagement in your life. I mean, those are tremendously important things.
Well, you brought up support groups, and I want to come back to that. I actually want to talk about that in a little more depth, but I wanted to maybe start with a term that I've heard you use a lot, and that is the term mental wellness. Mm-hmm. We hear mental illness, mental health, mental wellness, recovery. I mean, there's all sorts of words that people use when they're talking about mental illness, but I've heard you use mental wellness a lot. Could you define that, what you mean by that, and how you see how does that play into someone's illness and how that might change for them over time?
Yeah, I mean, the reality is, we use the word mental health a lot of times, and people, immediately think abnormal psychology, and really, we're all on a mental journey, and we're all on a continuum of mental health. And so so really the idea is we want to be as well as we can. And when a person has a mental health problem, it's not a death sentence. I mean, there are lots of chronic conditions out there. So I think the best example is you think about how we talk about diabetes. We talk about diabetes in a very positive way, like, diet alterations and take your medicine and get some support and exercise. And then we see a commercial where the guy's out running and he's in the sun, and it's a wellness kind of approach. we never talk about that with mental health. It's always dark and dank, and the person's isolated. So mental wellness is really just the idea of a process to become as kind of mentally healthy as you can, to have as high a quality of a life as you possibly can, given whatever your mental health issues are. So an individual with schizophrenia can talk about mental wellness. They can improve the way they think about things, the way they perceive things. They can even their memory, things like that. And it can be done with any type of mental health problem. A majority of people, a vast majority, like 80 to 90% of people that engage mental health care, proper mental health care, will see some success.
Yeah.
And so, I think one of the things we do is we say abnormal and normal. And so you've got to go from here to there. And if you don't get to there, then there's no, and I don't think that's how it is for anybody. It's kind of a process, and that's mental wellness. It's getting better every day. That's what I say to my clients all the time. It doesn't matter where you are today. You can be better than you are today. And that's the process of kind of mental wellness and being better.
That's good. That's really good. It's
very much like our sanctification process spiritually. I mean, it's very much that way,
Yeah, well, just in case somebody isn't familiar with sanctification, what do you mean by that?
We're saved, when we come to faith in Christ, but, as we all know, we still continue to sin, and we're broken, and we have all kinds of issues. And, as we are more receptive and more humbling of ourselves to the Holy Spirit, we're transformed. Like Paul talks about, be transformed by the renewing of your mind. That's that submission to the Spirit, and your thoughts are changed and your behavior's changed. And in essence, it's spiritual wellness. You're growing, becoming more in the image of Christ. And that's the same thing with mental wellness. You can put that into a very temporal sense, in a very worldly sense, and that you're just getting, your thoughts are more efficient, your behaviors are more controlled. And so it's very similar to that sanctification process. In fact, done within a faith-based context, it is the sanctification process.
Well, and I think you would probably agree. I think I've even heard you say this, or it could have been Dr. Eric Johnson, a mutual friend of ours, but we've talked about wholeness and that we are on a continuum in every area, every domain of our life. So there's spiritual growth, as you talked about sanctification, there's mental, there's emotional, relational.
And it's all connected. It's all affecting one another. Absolutely.
And there's that interplay between them, and that we need growth in every one of those areas. It's not just, sometimes when people ask me about, what approach would I take to someone who's experiencing a mental illness, and I've learned that it's not just this or that. It's actually a whole combination of things, and some of it involves our body, some of it involves our mind, some of it involves our relationships, some of it involves our walk with God. And so that I've come to believe that none of us make any progress in our lives unless we're engaging, seeking help in every one of those domains. I've heard you say something.
I agree with that. Absolutely. I think one of the problems, again, with our quote unquote mental health care system is that it takes very narrow approaches to care. And leaves a lot of things out. And so, you can't really move along towards wholeness or towards mental wellness unless you really have a holistic approach to your care.
So you mentioned a few minutes ago support groups, and you talked a little bit about it, but I want to just, what is it that you think happens in a small group or a support, called it a s'more. I think I'm dreaming of a marshmallows and graham crackers and chocolate. Too early in the day for that. But a support group, what do you think happens in a support group that makes it so valuable?
Support groups they're all types. There's support groups for caregivers, people that live with or care for someone who's mentally ill. There's ones for people that are mentally ill. There's ones that are divided up based on your illness. But I think what's important about it, number one, is that it is a shared experience. Everyone in that group is sharing a similar experience. And oftentimes when we struggle with difficult situations, we very quickly conceptualize it as if we are the only one that has that. So there is no hope, because since it's just us, there's no one that ever got out of this. And so being in a group with people with shared experiences, you just before anyone says anything, there is hope, because everyone's at different levels. So if you're at a lower level than someone else, there's hope that you can rise to that level. I think also, this idea of support, which is a tremendously biblical idea, the idea of coming together, sharing our experiences, and helping one another, ministering to one another, whether it's a faith-based group or not, that's ministering to one another. It's relieving one another's suffering, and so walking along. It's the ultimate burden bearing. So in a support group, you are lifted up by others that have a shared experience. And I think more importantly, I really like support groups that are kind of curriculum driven, that are more psychoeducational, and they have support in them, but they're also educational. So you're learning about your illness, you're learning about treatments and management and how to be stable and how to resolve conflict and all types of things like that. So there's a clear focus in what you're doing each night. And they're wonderful. The data shows without a doubt that support groups are tremendously therapeutic. People's symptoms are relieved. People have a better quality of life. In fact, the study I quote quite often is one that demonstrated, really I think is pretty amazing. It demonstrated that in individuals who really didn't recognize they were ill, that weren't getting care, if you put their family members in a psychoeducational group where they learned about the illness and received support, that individual, even though they were receiving no care, showed improvement in their symptoms.
Wow, just by the family member.
Just by the family members being in a support group.
Wow.
So it changes the family member's perception. It changes how they react to that person. It changes everything. I mean, mental illness is not just a singular illness of a person. It's it's a dynamic that just destroys families, and so if the family desperately needs to get support, and if the family gets support, there's improvement in the individual who's ill. So a lot of times, individuals don't recognize that they're ill. The anosognosia, they don't really recognize that when they're, people with schizophrenia, things like that. They'll tell you, they'll be completely delusional, and they'll tell you, as a matter of fact, there's nothing wrong with me. I don't know why I'm even here. And so families often ask me, how do I get this person into care? And I'll say, well, unless they're suicidal, you can't force them into care, but you can go into support group tonight, and that will impact.
That is great. I'm sorry. That is such great advice, because I think, I feel like I just talked to hundreds and hundreds of people, particularly since Matthew died 5 years ago. And I hear a couple of recurrent themes. And one of them is, how do I get my loved one into care? My loved one, he or she doesn't really understand the depth. I'm thinking of good friends who have an adult child who just sincerely makes the same, gets into care for a short period of time and then feels like, I don't really need this, gets out of care, life deteriorates, there's a crisis, it's just this constant cycle of severe mental illness. And I think that that's probably the hardest, is when there is this severe mental illness, the intractable nature of it, where, people have done everything they know to do. And like I said, a loved one may bounce in and out of care. And for them to say, what am I, how do I get them into care? But your answer is, you may not be able to get them into care, but you can take care of yourself. That is critical. That is critical advice.
And that's not being selfish, because I know a lot of people say, well, it's not me. I'm not ill. I need to help them. Well, you are helping them. And if you fall apart, you can never help them. So the research shows that the best thing you can do when you can't get them into care is get yourself into a support group, start learning about the illness, get support for yourself. That will help them.
I remember when Matthew was diagnosed with borderline personality disorder, and I really had never heard of it. And it was probably about a year and a half before he died. And so the diagnosis came pretty late. His illness was so severe. He had some other illnesses as well. So it wasn't even just borderline personality disorder. But I'll never forget when I started talking to someone, an expert on borderline personality disorder. I read her book. I talked to her. She lives in New York. And so I'm talking to her on the phone. I went to a weekend family experience, and it changed everything. It did not change him. I mean, obviously my son died, so it didn't change him. But what did change was our ability to, as we learned about the illness that he was struggling with, how best to communicate with him. We totally changed the way that we were talking to him, changed the way that we engaged in him. engaged with him. And, after he passed away and we were looking at some of the conversations that he had online, they were archived and you could go back and read some of them. And it was so touching to me to read that he had said to other people, my parents finally get me. They finally understand me. I feel like we've been speaking two different languages my whole life. And even though I feel still really bad about my life and don't have hope, my relationship with my parents has changed. And so I think even though that's a hard story and that might not be encouraging to somebody else, the point I'm trying to make is that with some psychoeducation, with some education about an illness, approaches, even though it may not change the other person's illness, it can change your relationship with them. Right. And that at the end is what we want. That Absolutely. At the end of the day, I mean, of course, I wish that Matthew had been healed. But second to that was I wanted our relationship to be good and loving and him to know how much we cared for him. And so the value of getting support, the value of getting education as a family member was just incalculable. It made all the difference in that part.
Right. It will reduce. I mean, the reality is, I mean, even though there was a really very negative outcome for Matthew, ultimately, there was improvement in relationship. There was reduction in conflict. Yes. I mean, those are improvements. Those are metrics that are actually used. And so, if you're in constant conflict with your loved one, your 28-year-old son won't get care and you're constantly arguing and fighting, you're never going to win. And so your best bet is to go to a support group because ultimately you're going to have a better relationship and a reduction in conflict, and that's going to improve everything.
So if somebody hasn't, if someone's never been to a support group before, and it's amazing to me, that's another thing I hear, people are very reluctant.
They are. And, we found strangely, I thought everybody knew what a support group was. And most people have literally no context. Yeah. They just I don't even know what that is. I mean, why would you do that?
It feels like I'm just going to be, putting my dirty laundry out there for everybody to see, or they're going to judge me, or maybe they're going to make me confess something that I don't want. There's a lot of fear and anxiety. So would you mind just telling us what happens in a support group typically?
Yeah, I would say first off, there are going to be good support groups and bad support groups. So you have to realize that a support group is not what most people think it is. And that is, everybody's sitting around in a circle saying the most horrible things that are happening to them. And then you leave and you go, wow, I'm glad I'm not as bad as that other guy. If that's what your support group is like, then that's a bad support group. In fact, that unstructured venting like that is shown to be really negative to mental health. So what a support group is a group of people with a shared life experience. So everybody in the group has a similar experience. So for instance, here at the Hope and Healing Center, we have a lot of groups, but one that just popped in my head is we have a group for women who have been sexually assaulted or victims of domestic violence. So it's about 8 women. They all share that experience. They're all at very different places in recovering from that. In fact, some of them are actually still being abused presently because they have not gotten to a point where they will have left their husband or whoever is abusing them. So they share this experience. So there's a facilitator, which may be a licensed mental health care provider or a trained peer. If it's a trained peer, it's usually someone who already shares that same experience but's recovered. And then you typically sit in a room and no one is forced to talk. You can sit there and be quiet. We have people in support groups that rarely ever say anything. They just listen. But usually there's a lesson for the evening, some type of a topic that you either discuss or a lesson that you go through and you learn about. So for instance, in some of our groups, you might learn about the use of medication in mental illness or conflict resolution. And the facilitator leads this discussion. And there usually is a time of support where people can talk about things that I know in our faith-based groups, we always talk about how's God working in your life this week? What are some praises? And then what are some difficult things? And then people will share, I've had that same thing happen to me and this is what we did. And it was horrible. It didn't work at all. Or it was wonderful. It took us 10 years to figure out that this is what, and some of those are good suggestions and they might work in your life and some not. But ultimately what happens is you build a community around yourself of people who care for you over time, of people that you talk to outside the group. And it becomes a group of friends who really understand what is going on with your illness or with your loved one's illness.
I think there's such power in I mean, we've seen it particularly in in our culture this year, the Me Too movement. But that phrase "Me Too" is so broad. And really, it just means any shared experience. And whether that's, if someone's been, sexually abused, or they live with someone who has a mental illness, or I know as a mom, just talking to another mom, or now as a suicide loss survivor, to talk to somebody else as a suicide loss survivor, the power of, me too. I've gone through that, or I've experienced that. It's just, you cannot measure the power of comfort that brings. I love about support groups, and it's also about some of the Celebrate Recovery groups that we have here, or some other AA or something. Also the power of freedom, of not hiding,
right?
Because I think we can fool ourselves into thinking that I'm okay with not sharing. I'm okay with keeping this just to myself or just within our family. And you get used to living in a certain way. You get used to living in dysfunction. You get used to living in hiding. You get used to living in pretending. And when somebody cracks that door open just a little bit, and you get a glimpse of freedom on the other side, or you get just this slight whiff of the air of freedom, your soul responds to that. And most people will say, as they actually then push open that door and walk into the freedom of no secrecy, no hiding, no shame, no pretending, most people will say, I would never, ever go back to that place.
Right, absolutely. I mean, if you're, if you're a person, all of a sudden your 22-year-old son has a psychotic break and he's hospitalized, and now he has bipolar disorder, your best friend does not understand. I mean, that doesn't mean they're not a good friend, but they have no context for unless they had the same thing happen to them. And then you will undoubtedly be overwhelmed by the stigma and shame of our society related to mental illness. So you will be very quiet, and you won't really want to try to talk to other people. But as you said, you walk into a support group, there is no stigma and shame, because everybody has the same issue, the same life experience, and you can breathe. You can tell people what's going on. You can yell at God. You can do whatever you need to do. And everybody's like, I get that, because I've been there.
Fall apart.
Absolutely.
But people are afraid to fall apart. I think that we have this fear. I remember for myself, before I went to counseling for having been molested as a child. And my greatest fear actually was that if I ever really talk about this, I will fall apart. Right. And I won't ever be able to recover. I will fall apart so badly that I will never be able to even, if I ever start crying about this, I will never be able to stop. And I think that when you have a loved one who has a mental illness, or yourself, or you live with one, that fear can take over and can keep you from getting the help you need. That if I talk about this, I'm going to fall apart and I might not recover. And the story, I think that's why it's so important for people to tell their story, because people who will say, I've been there now, and I did that, quote, falling apart. And yes, there is recovery from falling apart. That doesn't, your life actually has a whole new freedom, a whole new sense of meaning, of joy that was not possible when you were so afraid of falling apart.
Right. Absolutely. No, absolutely.
So if we have, I bet this conversation has reminded me of some folks I've been talking to recently who are in the ministry, who are clergy. And so if we're talking about, just the average person having fear of getting support or asking for help, I mean, you deal with this as well, talking to folks who are in the ministry or in the clergy. So just talk for a minute about the particular pressures that they feel, maybe about getting help, and what you could say to them.
Yeah, I mean, we unfortunately we've elevated clergy to a kind of this higher standard, and that expectation, even though it's not realistic, I think a lot of clergy adopt it, and so they can't talk about their problems, and certainly if there's a problem like a mental health issue, because there is a subset of people in Christianity that's over spiritualized mental health problems, and so how can my pastor have depression? Because that's a spiritual thing. And so, or somehow he or she is not, very faithful, and that's why they have this problem. Or why does his daughter have bipolar disorder? He must not be a very good dad, or they're not good parents. And they internalize that. And so clergy do not seek out care, unfortunately, and they don't even seek out care for their family. I've seen clergy, when they have sought out care, literally go to another town so that no one would see them go in to see a counselor. I've known clergy that elder boards dismissed them when they found out they were taking medication for their depression. Just all kind of ridiculous things. And the reality is that, don't you want your clergy to be healthy? I mean, these are illnesses like any other illness. And if your clergy have those problems, if your clergy member stood up in the pulpit and said, I've got diabetes, but let's not talk about that, I'm not going to do anything, I mean, everyone would talk to him all week about how he needs to get help. So it's the same thing. And so we need to recognize that they're people too. They struggle with the same kind of problems we do. In fact, they're an extremely high pressure job, which makes it more likely that they might deal with anxiety or stress or depression. And so we need to make sure that they're mentally healthy, just like they're physically healthy. We need to make sure that their marriages are strong. We need to make sure that their families are mentally healthy. I think every elder board needs to have a conversation with the clergy that they oversee and say, if you're struggling with any problem, you need to come to us, and we're going to receive that like the brothers and sisters that we are in Christ. We're not going to shun you for that. So I think they're just very scared to do that. Now, if the mental health gateway that we've set up was set up originally as an opportunity for clergy to connect, and they still can connect there confidentially. But it is very, very difficult. It's a frightening thing out there. And, it's not made any better by the fact that there are some high profile clergy that promote this idea that it's spiritual. Right. So it makes it even less likely that they're going to seek out help.
Well, so I see, a role for both the members of a congregation and the clergy. And so what I hear you saying is that the way that the members of a congregation can help their pastor, his or her family, is to support them. In other words, create a climate that says you're a human being. We recognize that, and we want to treat you and your family as though you're a human being.
Absolutely.
Not on a pedestal where you're different from us and you can't do that. So that's a role that somebody in every congregation, whether you're an elder or a deacon or not, you as a church member, those of you that are listening, you can help your pastor and his or her family by making that known, that you see them as a human being, you treat them as a human being, you create a climate in which they don't have to feel like they have to pretend, put on a show, keep stuff hidden. And then on the side of clergy, if you're listening, to really take this to heart and have the courage to come to your elder board or your deacon board or trusted friends within the church and say, look, we are people. My wife and I, my husband and I, kids, we're just people. And, as such, we're going to have some problems. We're going to have some things that we need to work out. And so it's got to work both ways. Both sides have to cooperate for there to be change and help for clergy. I really believe in that. So let's move from there to, because you talk about clergy. And so I was going to talk about men, and most clergy in America are still men. And so we can segue pretty nicely to that, because there is a huge difference in the way that men approach mental health. So much so that in the next few weeks, I'm going to do a Facebook Live just on men and mental health. But the statistics have shown that men are 4 times as likely as women are to die by suicide. Women are more likely to attempt suicide because they use more non-lethal means, right. But men are more likely to actually die by suicide, and they're less likely, according to Mental Health America, they are much less likely than women to seek help for depression, substance abuse, and stressful life events. So, can you speak in a moment, just about what you see and what you understand about men and mental illness, how we maybe can approach them in a way, because we might even need to approach them differently than we approach with that messaging to women.
Oh, absolutely. And our clinic here is no different than any other clinic in America. I mean, the vast majority of people that come here are women. And I think that, really the obvious problem is that the way we socialize men is, we have taught men, we've taught everyone that talking about your problems and kind of sitting around, hand holding, and that's a feminine thing. Okay, and so the mental health system is basically appears feminine to men. And so men are taught that, we don't talk about our problems. We suck it up. We provide, we do what we, gotta, oh, I was sad and I just worked harder and what, and so our entire identity as men typically is based on what we do, not on who we are, how we feel. And women are much more feeling, men are much more doers. It's really a socialization issue. Most men, I think about my own father, and during his life, to tell him to go sit in a group of people and talk about his problems, I might as well pull his.
We've been talking about the very thing we've been saying.
Exactly. I might as well pull his fingernails out. He would enjoy that more. Okay, and so, I think the way we can get around this is not necessarily with the men we have now. It's with the young boys and men that were growing up. And that is, we need to sit down as families and talk about problems when there are problems. We need to not let the females of the group talk and the men are just silent and absent. And so, we need to teach our young men that talking about your problems is not a sign of weakness, that it actually is a sign of strength because you want to improve yourself. And that we also need to talk about the fact that mental health problems kill. These are not things that you just suck up and move on. Men are more likely to die of heart disease, and that's because of stress and all types of things. So, women, they are socialized to talk about their problems and their feelings. I'm not saying make men feminine. That's not what I'm saying at all. You can still adopt very traditional gender roles and do whatever you want. But the reality is that we teach young boys and adolescent males that to ever have a problem is weakness, and to ever discuss that problem is really, almost heretical sin kind of a thing. But we have to teach them that psychology, psychiatry, these are just other kind of medical interventions. These are illnesses that everybody has, that it's not weakness to sit in a group and talk about your problems. But again, one of the other problems that I see that's related to that is, look at our churches. Our churches are, other than perhaps the senior clergy, run by women. Women do the most of everything at a church, and most churches are attended by women. And again, to men, a lot of times faith seems very feminine because there's singing and there's talking and we have to get beyond that. We have to teach men it's okay. And just one last point, I would say that, men in therapy are very difficult to work with. They're very quiet. They don't express their problems. It takes a different approach than it does with women. And you need to be aware of that. So, men out there, if you are struggling with a problem, you don't have to, you can choose who you go talk to. If you'd rather go talk to a man, an older man, a younger man, you'd rather talk to a woman. You have options. Okay. You don't have to just go to, oh no, I'm going to have to sit down with some young 27-year-old brand new PhD female and tell her my problem. No, you can go pick who you want, find a person you feel comfortable with. And it's really not all that different than talking to a good friend. It's just that your good friend has a lot of information, a lot of knowledge about the problem that you're struggling with.
Yeah, you've raised. This. My mind is just racing because it's pretty complex. Yes, there is a socialization, and we're also in a place in which we're trying to we're learning about some of the ways that the term toxic masculinity is encountered in our world. We're giving men the message of it's just a complicated topic, and that's why a couple of weeks I'm gonna do a little more on this because I really want to dive into it a little bit further. But it's such an interplay, because if we've just said that men that it'd be, as you said, like pulling your dad's fingernails off or pulling his teeth or whatever to ask him to come sit, and yet that's what we do in support groups. That's exactly the model that we have for support groups. And so it's like, okay, so how do we need to think this through, how to reach men perhaps with the information that they need, the psychoeducation, the support that they need, the spiritual support that they need, but maybe there's some other ways that feel more natural to men. And so if any of you who are listening have some great ideas, please send them in, because I think this is a major issue that we need to tackle. And I certainly don't see myself as any kind of an expert on this, as much as just raising the question of, we have to do a better job of, engaging men in mental health care. So as we kind of wrap this up, you alluded to this earlier, but maybe just for somebody who's just coming in, maybe they didn't see the whole thing, but that mental illness is not a chronic illness that's a linear. It has ups and downs. People are on spectrums. People are on, they may have a period of great strength and stability, and then they kind of hit this bump in the road. And so it's just not this clean line. So for somebody today, maybe who is discouraged at this 2 steps forward, 1 step back kind of thing, how can we leave them today with a little bit of hope?
Right. Well, I mean, again, I think recovery is a process. And I use the term recovery. A lot of times that's just used for addiction, but there's recovery in mental health. And it's a process. And there is no doubt that you can be better, or your loved one can be better than they are today. And if they are better, then that is a positive thing. But you're right. It's not a linear process. There's ups and downs, but there's ups and downs with everything. I mean, somehow we oh, my kid took his medicine and he's not perfectly fine again. That's the stigma and shame talking. As I said before, the vast majority of people that engage effective care do show significant improvement. And certainly there are problems where individuals don't understand that they're ill and they stop taking their medicine and things like that. But again, if you understand that those things are a possibility and that they are, in fact, in some instances likely to happen, then you understand that they're just part of the process. They're just part of the process. I would tell you that, hope for we who are believers is more than a feeling. It's a person. And that person is Jesus Christ. And the hope of Christ transcends circumstances. I mean, we live in a fallen world, and that's why these types of things happen. But we do have, a Savior that can empower us to see those through. And again, just from a very temporal, almost selfish perspective, people get better. If you are mentally ill today and you're getting treatment and you're not getting better, and it's been 6 months and you haven't seen any improvement, it's time for you to look for other mental health care provider. It's fine for you, build a team around you that can support you, but you should be showing improvement. You should be getting better. Things should be improving in your life. If they're not, then you need to think about looking for another mental health care provider.
That's a good word. That's a good barometer for folks, because sometimes you don't know how long you should give something before you make a change. So that's good. That's a good barometer. Well, thank you so much, Dr. Stanford. I want to just, we talked a lot about support groups, and you mentioned, Fresh Hope, which is offers support groups, freshhope.org. There's the Mental Health Grace Alliance. Is that .org, that website?
.org, yes.
Well, yeah, we'll pin that on there. But yeah, Mental Health Grace Alliance offers support groups for families and individuals. At Saddleback, we have something called Journey Toward Hope, and you can get that at kwarren.com. And there's the book. You buy the Journey Toward Hope book, and then there's a free download of the Leader's Guide. NAMI, National Alliance on Mental Illness.org, has support groups, a 12-week family-to-family class. Great. Everybody should take that. There are good resources out there, and we want to encourage you to seek support and to just keep in mind, as Dr. Stanford says, that it's a growth process, and there is hope. So thank you so much for being with us today.
Thank you.